Do you have pain right in the buttock? It might be your proximal hamstring tendon causing issue here. And we have a load of exercises we're going to go through in order of difficulty to work on progressing through to get this better. Hi, my name's Rob from AMR Physio, and this proximal hamstring tendon inserts right on the ischial tuberosity, those sit bones. Sometimes pain in this area can be down to deep gluteal syndrome, where the sciatic nerve gets affected, which we'll talk about more in a bit. But the difference is that this tends to travel down the leg, often past the knee, whereas if it's just the hamstring, it's more localized to the buttock area, but can still be felt slightly into the hamstring for some. But for what we're talking about today, the pain won't travel below the knee. It can be a common injury for anyone sprinting or in sports, but generally a tendinopathy is due to overuse and going beyond the capacity of the tendon. So it can happen to anyone. It can be a very frustrating injury that can take several weeks or months to fully settle, and you need to work on gradually increasing the load through the tendon without aggravating it while on the rehab journey. The first step is finding an exercise you can tolerate that doesn't make the pain worse during or afterwards, and then gradually building from there. So how we've listed these exercises is in order of difficulty. So start with the easier exercises and make sure they don't aggravate, and then progress through to the harder later stage stuff in a gradual manner. So the first easiest exercise to work on for this is a bodyweight hinge. So all you're doing for this is basically with the back straight, just bending forward so that you're sticking your bum out backwards. This will put a bit of a stretch and start to load that tendon on the proximal hamstring, and then gradually come back up as you squeeze the glutes to come back through. So even if that's too hard or it's putting too much stretch on, that would generally mean it's pretty severe, but just don't go as far and gradually build up until you can get to a comfortable stretch and then come back. The next stage for this is going to be a shallow bridge hold. So you're on your back with your knees bent, your heels are on the floor with your toes up. Now you just want to very slowly just lift the bum off the floor and then just hold that. You can do this for reps, but do it very gradually and don't come too high for this. And you want to make sure there's no aggravation to this. A lot of the time with a tendinopathy, you can get pain 24 hours or 40 hours after doing an exercise. So you need to see how you respond before you start progressing to harder exercises. So if you are getting pain during an exercise, then that's definitely too much and you need to go back a step. The next you do for this is a hamstring curl. So even though the proximal end is more affected, you can still work on distal end stuff where it's more flexion based at the knee, because this is still going to work the hamstring and you want to keep the hamstring strong while you're rehabbing from this. But it's not going to put as direct load onto that proximal side as some of these other exercises will, but still add it in and give it a go. The next step from this is a full bridge isometric. So this time, rather than just doing a shallow lift, you're doing a full lift up and you're just going to hold it there. Work on building the time up, and again, just making sure no aggravation before moving to the next one. And the next one is a full bridge, what we call an isotonic. So that means you're moving through range. So you're going to lower the bum down as soon as it touches. You're going to lift straight back up, hold, and then slowly back down. You want to be really controlled when you're working with tendons, so be very slow and purposeful with your movement. Moving on from this is a single leg Romanian deadlift or a single leg RDL, just using your body weight to start with. So all you're doing, you're standing on the affected leg. You're then going to hinge forward, going as far down with your hand as you can, and then you're squeezing the bum and using the hamstring to return yourself to the starting position. The next step to this to make it harder is to use a weight with the single leg Romanian deadlift. So a weight on the opposite side can be really effective. You can also do weight in both hands or on the same side. It doesn't make too much of a difference, but adding weight to this is a way to progress it. Next is a TRX bridge. So this is like the normal bridge on the floor, but now there's a little less stability because you've not got the feet on the floor, you've got it in a suspension trainer. This will basically just make the hamstring have to work harder as it's trying to stabilize as well. Following from this, you can do a single leg bridge. So that's just bridging on one leg instead of two. So this makes it a lot harder. And then following that, you can start working towards light Romanian deadlifts. So this is when we're starting to get a bit more weight going through and a bit more load through that tendon. So you can even just start just with a bar, but really working on sending the hips backwards and getting that stretch. So it's not like a normal deadlift, because you're really trying to make the most of the stretch that you're getting in the hamstring to really start targeting that proximal hamstring as you come back up. Next you can try is a shallow Nordic curl. So again, this will work on the knee flexion side, but it also will get the full hamstring engaged here as well. And this is nice to start building into full Nordics, which we'll get to shortly. Following from this, you can do a TRX Bridge Curl. So this is where you're going to be up into the bridge, but then you're also going to do a curl. So you're actually hitting the hamstring at both ends, both that distal end and the proximal end. So a bit of a double whammy here and a really good exercise. So you're going to straighten the legs right out, and then as you come back and bend the knees, you're also going to bridge at the same time, so lifting your hips up in the air. A bit of a hold and then slowly return back and repeating for reps. Next you can try is a hyperextension. So this is going to be a little bit harder than the light Romanian deadlift, because you're going to be using more of your body weight for this. But again, you can adjust range on this in terms of how far you go down to make it a bit easier. And it's really important with this that you're not trying to work the back here, you're trying to work the hamstring and the glutes. So really work on that glute squeeze as you're coming up, which will also start to engage that hamstring more as you're coming up, rather than just relying on the lower back lifting you up. Next, we're now starting to get into much later stage rehab here. So these exercises can be quite hard, but you would have built up all the way through these other exercises first. So next is a TRX Single Leg Bridge. So it's working on the single leg, which is obviously harder than the double, but now you're not on the stable surface like you were before for the single leg bridge. So adding that difficulty in, and these are just hard generally. So even if you're just looking for a good hamstring exercise, this is one to think about as well. After this, you can then start working on Nordic curls and working on that full Nordic if you can. Use a bit of a push-up if you need a bit of help to work on this as well. But Nordic curls are really good in helping to prevent hamstring injuries as well. Next, we're moving into a heavier Romanian deadlift. So this is where you're going to start to add weight. You can keep adding some of the other exercises that we've mentioned previously if you're still finding benefit from there. But from here, you can keep building the weight on the RDLs to progress as you keep building up that load into the tendon. And you can also start moving back to running and sprinting drills at this time if you're wanting to, or you're needing them to return to sport. And then you also want to add in some more specific movements that will be required for whatever sport that you're wanting to do and get back to. And for this, when it's starting to feel good, don't go straight back into a full game environment with this. Even if it's feeling 100%, you need to make sure you're doing drills and training first to test it all out and make sure it's good. So if you're experiencing pain down the leg, especially below the knee or with any pins and needles or numbness associated, check this video out here, which goes through a likely cause when you've got really deep gluteal pain and with a different approach to help it than what we've gone through in this video. Otherwise, if it's definitely feeling like this, check out this video here, which goes through how many reps to do with the exercises and when is the right time to progress on to the next exercise as well.